Thank you, Nash. Asante sana. Thank you. I think she said I don't need the introduction, but I will tell you a story which I have already told in some events. This is about Kofi Annan. I don't know how many of you have heard that story from me. Can you raise your hands? How many? Can I see? No, very few. So I can tell you then. Kofi Annan was on a leave somewhere, a place where he thought he could have a break, a small village, and he thought nobody would know him. But one day when he was walking in the street, kids were coming towards him, kicking and screaming, and with some papers in their hands. So he didn't know what they were saying, but when they got closer, he heard them say, "Morgan Freeman, Morgan Freeman." Then anyway, he accepted his papers for signature, and you know what he signed? In order not to disappoint them, Morgan Freeman. Then he said, he was telling this story himself, and he said, "Please don't say Kofi Annan doesn't need introduction. Please introduce me." Because there are some people who believe that I'm Morgan Freeman. Yeah. Thank you. So, a time to remember the great Kofi Annan too. Thank you. And I like to tell this story because he's a great man and he should be remembered for all his legacy. Honorable Minister Budi, welcome. Honorable Minister Chiponda, Excellencies, Honorable Ministers, dear colleagues and friends. I would like to recognize especially one person, Ture Godal. Yeah, Ture. You know Ture. And I gave him a surprise call to invite him to join us. And he said yes, without any hesitation. And I was so happy. And once WHO, always WHO. And he said anything for WHO, and that's why he's with us today. Although, I would have understood if he said no, but thank you so much for blessing us, honoring us with your presence. Tusen takk, Ture. Tusen takk means in Norwegian, thank you. And thank you, honorable ministers, and all of you for joining us this evening. Vaccines are among the most powerful inventions in history. Thanks to vaccines, smallpox has been eradicated. Polio is on the brink. And many once feared diseases can now be easily prevented, including measles, cervical cancer, yellow fever, pneumonia, and diarrhea. With the recent development of vaccines against diseases like malaria, millions more lives can be saved. But only 50 years ago, in 1974, fewer than 5% of infants globally were vaccinated. Millions died of diseases such as measles, polio, and diphtheria. That was the year WHO launched the Expanded Program on Immunization, or EPI, as we all know. Today, about 84% of the world's children have received 3 doses of the vaccine against diphtheria, tetanus, and pertussis, diseases which were once a death sentence. With smallpox, the world showed that through unprecedented global cooperation, vaccines could actually be eradicated. vaccines could actually eradicate some diseases. Sorry. Building on that success, EPI supported countries to establish standardized vaccination program against smallpox and 6 other diseases: diphtheria, measles, pertussis, polio, tetanus, and tuberculosis. In the 5 decades since, every country has established an immunization program, often with support from WHO, UNICEF, and our partners. Now called the Essential Program of Immunization, these programs do far more than ever imagined 50 years ago. The EPI program helps millions of children, adolescents, and adults access vaccines against 30 diseases. A new study led by WHO estimates that the EPI has saved at least 154 million lives since 1974. An average of more than 8,000 lives saved a day for the past 50 years. Thanks to immunization, a child born today is 40% more likely to see their first birthday than a child born 50 years ago. This progress results from partnership. Leaders, scientists, civil society, communities, and families who have worked together to deliver on the dream of immunization for all. Thank you to all our partners here tonight. But vaccines don't deliver themselves. They require a person, and not just any person. So I say thank you to the health and care workers all over the world who ensure the promise of vaccines is realized. Earlier today, the World Health Assembly approved the 14th General Program of Work, GPW14, our global health strategy for the next 4 years. Today, we also launched the new WHO investment case, which estimates that if fully funded, GPW14 could save 40 million lives over the next 4 years. One of the main ways we can save lives is through immunization. The EPI is one of our best examples of what's possible when we invest in WHO, work in partnership, and prioritize health for all. WHO is committed to working with all of you to realize the power of vaccines for more people. I would particularly like to acknowledge the very important role that Gavi plays in supporting access to vaccines around the world. Just as we ask donors to fully fund the GPW, we also ask you to support Gavi's replenishment later this year. And I would like also to welcome Sania and give her our full support. Of course, she's still new to the job and she needs the full support from all of us. More than 14 million children in 2022 did not receive a single dose of vaccine. Working together with partners like Gavi and UNICEF, we aim to halve that number by 2030. Tonight, we celebrate the incredible success of EPI over the past 50 years. It shows what is humanly possible. With continued research, investment, and collaboration, we can save millions more lives in the next 50 years and beyond. But you know the serious challenge that's posed by anti-vaxxers, and I think we need to strategize to really push back, because vaccines work, vaccines affect adults, and we have science, evidence on our side. I think it's time to be more aggressive in pushing back on anti-vaxxers. I think they use COVID as an opportunity and all the havoc they're creating. Maybe that's one of the messages also I would like to include to whatever I have said. And thank you to all panelists, and thank you also to all colleagues, partners who have joined today, and look forward to continue to work with you to save children, to save lives. Thank you so much. And moderator, Nash, back to you. Again, asante sana. Jambo.
Si jambo.
Habari yako?